All right, so last thing is that abnormalities of acid-base balance are classified as either being metabolic or respiratory. And so respiratory acidosis and alkalosis, one thing, and I'm going to give you a little heads up about what you are going to see on your exam. On your written exam, you are going to be given the normal blood gas values for pH. It should be between 7.35 to 7.45. That's not new. PCO2 should be between 35 and 45. That is also not new. But a new value that you haven't been told before is that our bicarbonate values in the blood should be between 22 and 26 milliequivalents per liter. And it is an ion, so we measured it in milliequivalents. And so you're going to be given these values on the written exam. You're not going to be given them on the practical, but you're going to be given them on the written exam. So you're going to be told what normal values should look like, and then you're going to be told what the patient's values look like, and then you're going to give a diagnosis based on that. So respiratory acidosis is first. So first of all, these are again the normal patient or the normal values here. Here are the expected patient results for respiratory acidosis. So for respiratory acidosis, because it's acidosis, we already said what the value is for acidosis. It's going to be less than 7.35, so below our normal range. We should expect someone with acidosis to be less than 7.35. As far as PCO2 and bicarbonate values. So for PCO2 and bicarbonate values, if it's respiratory acidosis, then you are going to see your CO2 out of range. It's a lung issue, a respiratory issue, and so your CO2 values are going to be off. But because this is a respiratory issue and not a renal issue or metabolic issue, then our bicarbonate levels are going to be normal. It'll be that 22 to 26. Okay. So if it's respiratory acidosis or alkalosis, it's going to be your CO2 values that are going to be off. Okay. And really, if we remember, CO2 and hydrogen ions go hand in hand. And so if you have a low pH, lots of hydrogen ions, that means you're going to have a lot more CO2 as well. And so you're going to expect to see greater than 45 millimeters of mercury for CO2. That's for respiratory acidosis. And so the cause of this would be things like, and this is already in your lecture notes, so you can follow along in your lecture notes, but we would experience respiratory acidosis if our respiratory rates were low. So low respiratory rate, meaning we're holding on to CO2, more CO2 is around because we're breathing slowly and we're not getting rid of it as fast. More CO2 pushes the equation to this direction, which is going to form more hydrogen ions, which is going to make our pH drop. So this is respiratory acidosis. And so instances or times where our respiration rate is low due to respiratory dysfunction is things like severe asthma, emphysema, or any other form of COPD. Pneumonia could be one, trauma, shock, hypoventilation for whatever reason. And so you have a lung issue that's causing you to breathe more slowly than you should, which is bringing your pH down, your hydrogen levels up, and CO2 levels are up because you're breathing slowly. So that is respiratory acidosis. So next is respiratory alkalosis. So with respiratory alkalosis, because it's alkalosis, you're going to expect a pH of greater than 7.45. And again, this is a respiratory issue, so our bicarbonate levels should still be normal, okay? The only time our bicarbonate levels are going to be off is when it's a metabolic issue, which means it's a kidney issue. So this is just going to be the opposite. If you have high pH, you have low hydrogen ions available, which means you're going to likely have low CO2. So CO2, you're going to expect to see less than 35 millimeters of mercury. And so an example of when this would happen is what we just talked about earlier, is when you are getting rid of too much CO2, like in the case of hyperventilation. You're breathing too fast, offloading too much CO2, so that means you are taking bicarbonate, combining it with hydrogen ions, which is why we see a drop in hydrogen ions because of the drop in CO2. Because these bicarbonate and hydrogen ions are going to combine to make carbonic acid. That carbonic acid is going to use carbonic anhydrase to convert into CO2 and water and allow you to keep offloading that CO2. So that means your CO2 levels are going to be low, your hydrogen ion levels are going to be low, but your pH is going to be high. So that is respiratory alkalosis. Next is metabolic acidosis. So the expected patient result is acidosis. So pH will be less than 7.35. Because this is a metabolic issue, which means it's an issue with the kidneys and not with the respiratory system or the lungs, our CO2 should be normal. So between 35 and 45 millimeters of mercury. It is our bicarbonate that's going to be off. So if we're in acidosis, and bicarbonate is a buffer. So with acidosis, do you think we have too much buffer or too little buffer? And if we were in class, I would hear a bunch of you say too little. So we're going to have a bicarbonate level of less than 22 milliequivalents per liter because buffers are used to raise pH. And so if our pH problem is that it's too low, it's probably because we don't have enough buffer to balance it out. And so times when this may happen is chemical buffer system is overwhelmed. We just don't have enough buffer. We can see that here with the less than 22 milliequivalents per liter. Large amounts of acids were produced, like in the case of diabetes mellitus and the buildup of ketone bodies, which are acids. Large amounts of acid was ingested. So if you took too much aspirin, that's an acid or any other acid. Large amounts of bicarbonate were lost from the intestinal mucus, like in the case of diarrhea. Or lactic acid buildup from too much anaerobic respiration. So these are times when metabolic acidosis can occur. Okay. Last is metabolic alkalosis. With alkalosis, we are going to expect a pH that is too high, so greater than 7.45. And again, this is a metabolic issue, not a lung or respiratory issue. And so our normal CO2 or because this is a metabolic issue and not a respiratory issue, we are going to see our CO2 levels as normal because this is not because of lung dysfunction. So our CO2 levels should be in the normal range. What's going to be out of range is going to be the bicarbonate concentration. And so if we're in alkalosis, meaning our pH is too high, then we likely have too much buffer, too much bicarbonate around. So it's going to be greater than 26 milliequivalents per liter. And so when this could happen is ingestion of too many alkaline substances like bicarbonate from antacids or milk of magnesia, or excessive vomiting. If you remember, when we vomit and we empty the contents of our stomach, we have to make more hydrochloric acid. And when our parietal cells make more hydrochloric acid, we have this alkaline tide that puts more bicarbonate into the blood. And then if you vomit again, you make more hydrochloric acid, more bicarbonate into the blood. That alkaline tide, if it's happening constantly because you keep vomiting, it's going to cause a rise in pH, and you'll be in metabolic alkalosis. So that is the last example. So on the exam, what I want to make sure that you do. So again, you're going to be given the normal values. You're going to be given patient values, and then you have to diagnose. So my suggestion is that you look to pH first, okay? Because you're going to have options of respiratory acidosis. Is it respiratory alkalosis? Is it metabolic acidosis? Is it metabolic alkalosis? And the last option is going to be none of the above. So you want to look at pH first. If pH is like 7.4 and it's within the normal range, then you say none of the above and you move on. It is not a pH balance issue. The pH is normal, so there's no diagnosis to give. So look at pH first. If you look at pH and it's below 7.35, then you know it's acidosis, so you can eliminate the alkalosis options. So you know it's acidosis. And so then you're going to look to CO2 and bicarbonate. If the CO2 levels are out of range, it's respiratory acidosis. If the bicarbonate is out of range, then it's going to be metabolic acidosis. So make sure that you do that. Look at pH first, then look at CO2 and bicarbonate to see if it's a respiratory issue or a bicarbonate issue. They will not both be out of range. You will not see that in the examples that we give in class. So again, find out if it's acidosis or alkalosis first, or if the pH is normal, it's none of the above, and move on. And then from there, you're looking at CO2 and bicarbonate. If bicarbonate's out of range, it's going to be metabolic. If CO2 is out of range, it's going to be respiratory. So that's a little bit of advice for you too when you're looking at those questions on the exam. One thing to know, these are all reasons for having acidosis, alkalosis, both metabolic and respiratory. And so make sure that you know this is all uncompensated. So one thing that you'll learn if you go on to nursing school is that when you have respiratory acidosis or alkalosis or metabolic, your body tends to compensate. And so you'll see other events occur. And so the examples that we're given here in class are uncompensated. So this is just the way that it is. When you have that metabolic acidosis, alkalosis, or respiratory acidosis, alkalosis without compensation from the body. Yes, these are uncompensated. You'll learn about compensation when you get into nursing school. And that is it. That is the last lecture in Bio 33. So you have survived all the lectures. Make sure that you're studying hard for the final exam. And please reach out to me if you have any questions. Bye.